Today I want to talk to you about my approach to answering questions on applied respiratory physiology. Starting out, I like to think about three major headings to help jog my memory. First off, I like to think about the anatomical changes that occur. So for example, the anatomical changes that affect respiratory physiology and obesity. Next, I think about key respiratory physiology equations and try to apply this to the specific scenario. And the best part is that there are only 4 equations to remember. Finally, I think about the key functions of the respiratory system and how these change for a specific clinical scenario. Now, looking more closely at the equations, the first one is pressure equals flow times resistance. From this, the important factor to focus on is airway resistance. Additionally, we can look closer at pressure, which gives us our second equation. Compliance equals a change in volume over a change in pressure. From this, the important factors to talk about are respiratory compliance, which includes both chest wall and lung compliance, as well as lung volumes. We can rearrange this equation to give us the third key equation, which is pressure times volume equals work of breathing. Now, work of breathing is a very important topic and ties into many of the above respiratory factors, and I'll explain how they relate to work of breathing later in the video. The final equation is ventilation perfusion mismatch. VQ mismatch generally occurs because there is increased VQ scatter or shunt due to deleterious factors above, such as reduced lung volume, poor compliance, or poor circulation. The perfusion aspect of this equation is very helpful to ensure we don't forget to talk about pulmonary circulation, including pulmonary vascular resistance, right heart function, and determinants of pulmonary vascular resistance, such as hypoxic pulmonary vasoconstriction, carbon dioxide, and lung volume. So let's recap and look over the 4 key equations. We can see that compliance relates to and is affected by lung volume and airway resistance. We can now see that multiple factors such as pressure, compliance, lung volume, and airway resistance will affect work of breathing. As a side note, it's also important to mention what happens when there is increased work of breathing. For example, increased muscle fatigue, increased respiratory muscle oxygen consumption, and overall decreased respiratory efficiency. Now, I know this looks a bit messy, but the 4 equations are simple to remember and show how each element is intertwined, but also helps to trigger factors you might have forgotten when answering the question. Finally, we will cover the functions of the respiratory system. There are many functions of the respiratory system, but the major ones to talk about are the control of breathing, and here you want to try to explain how alterations in carbon dioxide or oxygen affect the respiratory drive, gas exchange, and this is often determined by the above factors which we pulled from the respiratory equations. For example, a decreased lung volume will cause a fall in functional residual capacity, which will result in atelectasis. This will cause increased VQ scatter and ultimately hypoxemia. Lastly, acid-base status. Ask yourself, does this particular clinical scenario result in a respiratory acidosis or a respiratory alkalosis? Then relate the observed blood gas findings to the control of ventilation. Alright, that's the end of the video. Thanks for watching, guys. Make sure you subscribe if you're new to the channel, and please like the video if it's helped you out. Please comment below for any questions you have or topics you want me to cover in the future. And just remember, every day you are learning more and more.